Hello, this is Dr. Gay from First Sec MRI, and this is a 44-year-old female who had a vaccine administered about 2 months ago, a little over 2 months ago, and she had pain during the procedure, and since then the pain is not resolved. So she came in for an MRI here, and just to get oriented, this is an axial view of the shoulder, left shoulder. Here's the front, back, here's the outside of the shoulder. We see the round ball, this is the humeral head, and it rotates within this bone here. This is the scapula. This portion is called the glenoid. It's a shoulder joint. Now in the back of the shoulder we see the deltoid muscle, which is this thick muscle here. It wraps around the side and front as well. But deep to the deltoid muscle again, which is here, we see another muscle, part of the rotator cuff. It's right here, comes in here. This is called the infraspinatus, and it attaches right over here. And we can see where it attaches, there's brightness on this. So the brightness means there's edema or inflammation. And also right where the tendon attaches to the bone, there's a little bit of brightness right there. So marrow edema, bone edema, and also edema within the tendon itself, right at the attachment. So this is an injury related to the injection of the vaccine. And we call this SIRVA, shoulder injury related to vaccine administration, SIRVA, SIRVA for short. And what happens is they can inject the needle a little bit too high rather than going down low right here into a deep, big part of the deltoid muscle and squeezing the muscle and going in where the needle tip should be right about here. They inject a little bit too high sometimes, or maybe a little bit too lateral, and then the muscle is thin up here, and the needle will go right into the tendon, or sometimes into the bone, or into the bursa that's over the tendon. But if the needle goes too deep again, like in this case, it will cause an inflammatory response within the tendon, or inflammation of the bursa, or maybe a direct injury of the bone, or sometimes a vaccine can go into the bone. But this is a case of inflammation of that infraspinatus tendon and reactive marrow edema, and a little bit of brightness in the overlying bursa. These can be intensely painful and last for a long time as well. So again, it's important to go down a little bit lower to the meaty part of the deltoid muscle and squeeze the muscle up so you're confident the needle goes into the muscle and it's not going to hit the bone, and then don't go too far lateral or superior. Thank you very much.